Hi, my name is Emily. I'm going to be your nurse for today. We're going to get started on your physical assessment, but first I'm just going to perform hand hygiene. Okay, you can have a seat. Okay. Could you please state your first name and date of birth for me?
Julie, 9/26/87.
Can you tell me where you are?
I'm at the hospital.
Can you tell me what year it is?
It is 2018.
And can you tell me why you're here?
For wellness exam.
Okay, so as you can see, the patient is alert and oriented ×4. She's not showing any signs of distress. She answers all the questions appropriately. When she walked in, we could see that her gait was steady. She had no problems with balance and does not need any assistance with that. Her skin color is white. She is a female. Some freckles are noted on her skin. Her facial expressions match her mood. She's happy. She maintains eye contact. She's calm and cooperative. Her posture is erect and appropriate for her age and symmetrical. There are no deformities noted right now. She is dressed appropriately. She is well groomed and clean. Her hair is brushed. And now we are going to weigh the patient. So Julie, if you would please step on the scale. Patient's weight is 157.2. I do not have the appropriate tools necessary to measure her height. If I did, I would have her stand back against the wall, heels touching the wall, feet together, arms down at her side with her shoulders back and her head up in order to measure her height correctly. Now, Julie, you can take another seat. I'm going to measure her vital signs. I do not have a thermometer to get her temperature. If I did, I would take her temperature orally under her tongue and would want it to be in the range of 36.1 to 37.2 degrees Celsius. I'm going to feel her pulse now and count for 30 seconds. Patient's pulse is 82, the rate was regular, and the strength was normal. Now I will take her blood pressure. Patient's blood pressure is 130/72. I do not have a pulse ox to measure the patient's oxygen level, but she is breathing on room air and there is no signs of respiratory distress. Now I'm going to look at Julie's skin, hair, and nails. When I check her skin is pink and warm bilaterally. There's no lesions noted. It is dry and smooth and firm. I'm going to check for her skin turgor by pulling some skin right under her clavicle. Skin turgor is normal. There's no lesions noted there. Her hair is evenly distributed throughout her body. Hair color on her head is brown. It is clean, groomed, and brushed. I'm going to look at her nails now. They are slightly curved. The nail beds are smooth and pink on both hands. Checking her capillary refill. capillary refill is less than 2 seconds. I'm going to check for edema in her legs. I'm squeezing. There's no edema noted in her feet, ankle, or legs on the left side. Checking the right side. There's no edema noted in her legs, ankle, or feet, and no edema noted in her hands or arms either. Next, I'm going to assess Julie's head. I'm going to palpate her skull, and I'm feeling for any unusual shapes or masses. Her skull is symmetrical, there are no masses noted, no deformities noted, and her head is symmetrical to the rest of her body. Now I'm going to palpate her temporomandibular joint. Julie, while I feel, open your mouth. Good, and then can you take your jaw side to side? Good. There were smooth movements, no clicks. Did that hurt at all? Any pain? No pain. Her facial features are symmetrical, her eyebrows are symmetrical, eyes and mouth are symmetrical to the rest of her body, and there are also no involuntary movements noted at all. Next, I'm going to assess Julie's neck. When I look, I don't see any lesions. The skin color is pink and warm. I'm going to test her range of motion. Julie, I'm going to have you put your chin to your chest. Good. I'm going to have you turn your head from side to side. Good. I'm going to have you tilt your head so that your ear is going towards your shoulder. Good. Other side. Good. And then I'm going to have you tilt your head back. And I'm just going to feel. Did not know any nodules or any deformities. Did you have any pain with any of that movement? No pain. And her motion was very smooth and controlled. Now I'm going to palpate her trachea. Her trachea is midline and symmetrical. I'm going to palpate her lymph nodes now with a circular motion. No nodules noted there. Did you have any pain when I was touching?
No.
Good. No pain. Now I'm going to stand behind her and palpate her thyroid. There's no enlargement noted, no deformities noted, and was there any pain when I was pressing?
No.
No pain. Okay, now we're going to assess Julie's eyes. So Julie, I'm going to have you stand up, and we're going to do the Snellen eye chart, which is 20 feet away. I'm going to have you cover one eye with the card, and I'm going to have you read the smallest line possible that you can see.
It's like the second one above the red line. It's PECFD.
Good. I'm going to have you switch eyes and do the same thing on the other side.
Same line, PECFD.
Good. Her vision is 20/20. Now we're going to do the confrontation test. You can sit back down. I'm going to have her cover one eye again with this. I'm going to bring my finger into her field of vision, and I'm just going to ask you to say now when you can see my finger come in.
Now. Now.
Okay, can you switch eyes? We'll do the other side.
Now. Now.
Good. And take that card for you. Now I'm going to test her corneal light reflex. Can you please just take off your glasses? I'm going to shine the light into both of her eyes, and if the test is normal, the light reflection will be in the same spot in both eyes. The test was normal. I saw the reflection of light in the same spot in both eyes. Now I'm going to take my finger and bring it in towards your nose. Don't move your head, just follow it with your eyes. Good. Her pupils match the acronym PERLA. They are equal and reactive to light and accommodation. Now I'm going to do the 6 cardinals of gaze. So I'm going to bring a finger in and you just follow it with your eyes. Don't move your head at all. Good. Now, her eyebrows are symmetrical, her eyelashes are evenly distributed, her eyelids, if you could close your eyes for 1 second, they are pink, there's no redness, no swelling, no discharge. I'm going to take a Q-tip and put it on top of your eyelashes and just lift up your lid a little bit.
Sorry.
There are no foreign bodies, no redness, no discharge on that side. Same thing on the other side, there's no redness, no discharge, no swelling, no foreign bodies. Now I'm going to pull down your lower lids and look at your conjunctiva and your sclera. Good, her sclera are white and her conjunctiva are red. There's no discharge, no swelling, and no abnormal redness noted. Next, I'm going to assess Julie's ears. I'm going to begin by palpating the external ear. So on her left side, there's no redness, no discharge, no swelling. On the right side, there's no redness, no discharge, no swelling. They are equal in size bilaterally. Her skin is intact. There are no lesions, no discharge. She does have some ear piercings. I'm going to push on your tragus here. Do you have any pain?
Nope.
What about if I pull your pinna? Do you have any pain?
Nope.
Let me do the other side. Any pain?
Nope.
Any pain?
No pain.
No pain. Now I'm going to take my light. I'm going to look inside her ears for any redness, discharge. No discharge noted. And the tympanic membrane is a pearly gray color.
Can you really see it?
There is no discharge noted, and in that ear, the tympanic membrane is also a gray pearly color. Now we're going to perform the whisper test. So Julie, I'm going to stand behind you. I'm going to whisper 3 words. You repeat those words if you can hear them, and then we will do it the same thing on the other ear. Okay?
A6D.
Good.
B7G.
Good. She passed the whisper test. I am unable to perform the Ryan-Weber test due to not having a tuning fork. If I did have a tuning fork, I would strike the tuning fork and I would place it on her mastoid bone back here behind her ear, and I would ask her to tell me when she no longer hears the sound, and then I would perform the same thing on her opposite ear as well. I would strike the tuning fork, place it on the mastoid bone over here, and ask the patient to tell me when she no longer hears the sound. Next, I'm going to assess Julie's nose. I'm going to inspect it. It is symmetrical to her face and the rest of her facial features. It is midline and in proportion to the rest of her face. There's no deformities noted, no lesions noted. Now I'm going to check for patency, so I'm going to plug one side of your nose and have you take a sniff, and then we'll repeat on the other side. Good. That shows us that her nose is patent. There's no foreign bodies up there and no blockages. So now I'm going to look on the inside of Julie's nose. I'm going to have you tilt your head back, and I'm going to look up your nose. Good. There was no discharge, no bleeding, no foreign bodies, no swelling noted up there. Her septum is midline, which is good. And now, Julie, I'm going to palpate your sinuses, right under your eyebrows and on your cheekbones, and just tell me if you have any pain.
Nope. Nope.
No pain noted while assessing her sinuses, which is also good. Next, I'm going to assess Julie's mouth and her teeth. First, I'm going to don some gloves. When inspecting Julie's lips, they are moist, they're not dry, there are no cracks and no lesions noted. I'm going to next look at her teeth. Can you tell your teeth? Her teeth are white, they're evenly spaced, they're clean, and they're straight. I'm going to now look at your gums. Lift your lips. Oh,
I bite them.
you bit your gums?
Uh-huh.
Her gums are pink with no lesions noted. Now I'm going to have you stick out your tongue, say ah. Good, the uvula goes up in the back when she says ah. Her tongue is pink and moist, no lesions are noted. I'm going to have you stick your tongue onto the roof of your mouth. Good, the veins on the bottom of her tongue are noted, and there are no lesions, and there is saliva that is present. Now I'm going to look at your palate, if you could open up. Her palate is hard, it is red, there are no lesions noted, no deformities. And now I'm just going to look at your cheeks. Good, her cheeks are red, they're moist, no lesions, no cuts, and no deformities are noted. Next, I'm going to assess Julie's thorax region. First, I'm going to point out the suprasternal notch, which is right here, and the angle of Louis, which is right here, which I am able to feel, and then C7 is back here. It's almost like a little hump on the back of her neck. I'm going to have you take a few deep breaths while I watch. One more. Good. Julie's respiratory movement is unlabored, it is regular, and it is even. So now I'm going to feel her chest cavity back here while she takes a deep breath. Good. She has symmetrical chest expansion when she takes a deep breath. Now I'm going to percuss over your lung fields and have you say 99 when I touch each area.
99, 99, 99, 99, 99, 99, 99.
Good. Vibrations were present when I heard her say 99. Now I'm going to auscultate all of her lung fields, posteriorly and anteriorly. Take a deep breath. To the front. Breath. Good. Julie's breath sounds were equal and clear bilaterally, and like I previously said, her breathing is unlabored and regular. Next, I'm going to assess Julie's heart. I'm going to listen to her apical heart rate and count for 30 seconds. Julie's apical pulse rate was 78 beats per minute, and her pulse was strong with a regular rhythm. There are no chest heaves present or noted on Next, I'm going to assess Julie's peripheral and vascular system. For this assessment, I'm going to assess her skin for color, temperature, texture. I'm going to look for edema, and I'm going to feel her upper extremity pulses, her lower extremity pulses. I'm going to check if her hair is evenly distributed, and then I will assess her Hohmann's sign. So Julie's skin is pink and warm. It is smooth on both the upper and lower extremities. There are no clubbing of her nails. There's no edema noted on her upper extremities. There's no edema noted on her lower extremities. Now I'm going to palpate her radial pulses. Her radial pulses are strong and the rhythm is regular. Now I'm going to palpate her pedal pulses. Her pedal pulses are strong and the rhythm is also regular. She is a younger female, so her leg hair is shaved on both legs. On her arms, it is evenly distributed. Now we're going to test her Hohmann's sign. So I'm going to have her sit up. I'm going to support her thigh while she bends her knee, and then I'm going to have her dorsiflex her foot. Bend your knee a little bit. And flex back. Do you feel any pain?
Nope.
Okay, let's do the other side. Any pain?
Nope.
And there is no redness or swelling noted either. Here we go. Next, I'm going to assess Julie's abdomen. I'm just going to lift her shirt up to inspect the skin. Her skin is warm, it is dry, it's firm, it's pink, and it is symmetrical. Now I'm going to listen to her bowel sounds in all 4 quadrants. Julie's bowel sounds were active in all 4 quadrants. Now I'm going to palpate softly at first, and then I will palpate a little deeper, and I'm going to watch her facial expression to see if she has any pain while I'm palpating. Any pain?
No pain.
Now I'm going to palpate a little deeper. Was there any pain with that?
No pain.
Okay. No pain. Now I'm going to do the ellipsoas test. I'm going to lift up her leg and press down and see if she has any pain with that. So if you lift up your leg, press down, any pain?
Nope.
And do it with the other leg. Any pain?
No.
Okay. And then now we will do the obturator test. I'm going to lift up her leg, turn it inward, and see if there's any pain. Any pain?
No pain.
Okay. Other leg. Any pain?
No pain.
Good. So Julie's bowel sounds are active, palpation did not hurt, and she passed both of those last tests. Next, I'm going to be assessing Julie's joints and muscles. I'm going to look at all of her joints for size, to see if it's equal bilaterally, if the contour is the same bilaterally, and then I will palpate for the temperature and any deformities. So the size of Julie's joints is equal bilaterally, the temperature is warm bilaterally, and the contour is the same bilaterally, and there were no deformities noted. Now I'm gonna have Julie perform Phelan's sign. So I'm gonna have you hold your hands like this at a 90-degree angle and press together. Is there any pain?
Nope.
Okay, no pain noted. Now I'm gonna perform Tinnell's sign. So I'm gonna percuss on her wrist. Any pain, numbness, or tingling?
Nope.
No. Do the other wrist. Any pain, numbness, or tingling?
Nope.
No. Good. I'm gonna have her stand up in front of me, and I'm going to look at her spine. Her spine is midline. There's no abnormalities noted. I'm gonna have you shrug up your shoulders. She has good range of motion, and they're symmetrical on both sides. You can sit back down. I'm going to, again, look at her elbows, wrists, and her hands. When I palpate, can you extend out and back in? Good. She has smooth range of motion, no clicking noises or sounds. Can you hold your hands out and turn over? Good. And while holding your hands straight out, I'm going to push, resist me. Good. And then I'm just going to look at her hands. And they are warm. There's no swelling. Do you have any pain?
Nope.
No pain, and no deformities are noted. Now I'm going to go to her lower extremity, and I'm going to have you extend out your leg. Good. And go back. Again. Good. Smooth motion. There's no clicking. I'm going to do the other side. Good. Smooth motion, no clicking. I'm going to have you flex your feet. Flex and extend. She has smooth motion. And then I'm going to have you turn them in and out. Smooth movement. Any pain?
Nope.
No. And then I'm just going to have you stand one more time, and I'm going to make sure your hips are aligned. Her hips are aligned. Any pain when I press there?
Nope.
No. Okay, Julie has good range of motion with all of her joints, no swelling, no pain, and no deformities noted. Next, I'm going to assess Julie's neurosystem. I'm going to assess some of her cranial nerves. So for cranial nerve number 5, I'm going to have her clench her teeth, and I'm going to palpate her jaw area, which is normal. And then for cranial nerve number 7, I'm going to have Julie smile. I'm going to have her frown. I'm going to have her close her eyes very tight. I'm going to have her raise your eyebrows up. And then I'm going to have her show me your teeth. And then close your mouth and puff out your cheeks. Good. So Julie's cranial nerve number 7 is working the way it should be. Now I'm going to take a cotton swab, and I'm going to have Julie close her eyes. And I'm going to touch this to your skin, and you tell me when you feel it each time.
I can feel it. 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 I can feel it.
Good. Now I'm going to move on to hand grasps. So if you could squeeze my finger. Good. Julie's strength is equal bilaterally. Can you hold your arms out for me? I'm going to press down, resist me. Good. Again, her strength is equal bilaterally. Now I'm going to do foot pushes and pulls. So can you push your feet against my hands? Good. And can you pull back? Good. Her strength is equal bilaterally as well on her feet. Now I'm going to do the Babinski reflex. Bring it up the bottom of her foot. Her toes fan out, which is normal. On the other foot, her toes fan out, which is also normal. Now I'm going to perform the Romberg test. So Julie, if you could stand up, please. I'm going to have you put your feet together, your arms at your side. I'm going to have you close your eyes while I observe you for about 20 seconds or so. Okay, there was no swaying noted, and she was able to maintain her balance. And now I'm going to have you just lift up your left leg. Good. And lift up your right leg. Good. She's able to also maintain her balance there. So you can sit back down. And now I'm just going to hold my finger out, and I'm going to have you bring your finger to my finger on both sides. Good. Good. Julie's neurostatus is intact and equal bilaterally. we do not have to perform a breast exam on Julie, but I'm going to teach Julie how to perform a self-breast exam on herself. So Julie, we like you to perform a self-breast exam monthly on yourself, and the best time to perform a self-breast exam is usually after your menstrual cycle. 4 to 7 days in the cycle is the best time. You also could do it in the shower with soap and water running over you, but you could also lie down and you're going to take 3 fingers and you're going to go in a circular motion and use 3 different levels of pressure to feel along your breasts and follow an up and down pattern. And then we also want you to sit up and you can examine your underarm when they are slightly raised, and then you can know any changes as well by putting your hands on your hips and looking in the mirror and having your shoulders slightly forward. Notice any abnormalities that way, and then if you do notice any abnormalities, we would just like you to know to consult your primary care physician and get it checked out so that we can pick up on things earlier rather than later.
Sounds good.
And this concludes your physical assessment, so thank you for participating.
You're welcome.